Here, how we explain about that how hair cycle happen, but how it's starting for the hair loss, how it will happen. Here we can see this is the dermal layer where hair starts growing. When shrinkage of started for the hair follicle because of one enzyme, that is a 5-alpha reductase activity, this is the main cause for the hair loss. When it will happen, then gradually is decreasing the telogen phase and then reduction of the anagen and telogen residue. Then what will happen? At that time, hair start falling down and the result visible is the hair loss, maybe in the men and the women. When we started, we can see from the side of the hair start falling down. Here, we can see when this is the normal healthy hair growth cycle. What will happen when it is normal hair cycle, when it will grow, but when DHT start increasing, that means hair loss started. After that, follicle maturation, that means is the decreasing size of hair follicle, this one, where as already hair break away in their shape. What will happen and how it will happen? Because of the 5-DH3, 5-alpha reductase is increasing the DH3 level, so we have to control the inhibition of the 5-alpha reductase activity, so we can reduce this hair loss. Now, here is a normal hair growth cycle, and how many hairs is a general description about that. If for a particular person is 100,000 hair follicle will happen in a normal hair cycle. What is there? Is a 3-4 millimeter per day is the average is a per day for the hair growth. When it is there, that will not be the normal hair cycle, but if it is not there, we have to care about that. Genetic factor, that is alopecia, including in other factor, that is a hormonal PCOD, thyroid, childbirth, menopause, and other factor. If they both are including, is a severe startness for the hair loss. That is the onset we used to call that, and that is starting for the early age of 20 as well as 30, and it's a very severe stage in a human being because we are care about that. Because our teenagers are suffering for the hair loss and we are also for the responsible for. Now, that is a hair loss, how it hair growth happen, how we have to target it. Now we have to consider about the market share. Day by day it will increase it because we have a very good requirement, and 2018 we are expecting 82.2 million USD. So it's a very good market. So that means we all are working together to take care of about the hair care. Now, previously we have a very small segment for that reduction for the hair loss. That is the drugs are available in a market, but now we have a shampoos, we have a conditioner, we have a serums, we have a gels, we have a spa cream, we have a lot of things to take care of our that all the things. Here, in a European country, it is estimated of the 2012 is cover 35% market share. It's very good. And after that is followed by the Asian and the other country. Now we have just describe about some statistics about only for that one country base. Here's a small diagrammatic and the numeric value, but is a worldwide is a very huge and large. If I'm talking about the US man expecting is the 35 million are suffering for the hair loss only in US. What about the globally? More than that, we are suffering for that. And that US women experience in a hair loss 21 million is a huge ratio. Then these are the data how the hair loss is happening by the age of 35 is a normal, but now these days is increasing. If you can see, now is that kids also suffering for that hair loss. These are the age of 35, we can see start, or like these are the normal now these days. Age of 60, we are mentioning, we are noticing is a 65% of hair loss will happen. Now, what is the treatment is going on worldwide? I just would like to say minoxidil. Minoxidil is a one, actually science is a miracle and magically as well. Minoxidil is invented for that hypertensive drug, but we got a side effect for that unwanted hair growth. We could have, our scientists work on that, and we 1998 we formed that minoxidil is a topical application as a hair growth stimulant. So sometimes we have to see what is a negative in that a positive. So minoxidil is a very big and high rich, 85% people are using minoxidil for the hair loss treatment. And other than patients is the finasteride and other drugs is also available in the market. These are the statistics what drugs are available in the market. How I mentioned about that minoxidil story, what will happen. But first I'll describe about like why 85% people are belonging for that minoxidil. How its mechanism of action, how it's worked by minoxidil. It's converted to minoxidil sulfate with the presence of catalyst. How it's working for the hair growth, because we describe about the hair cycle, and that it's activate the potassium channels. And what happens if the activated the potassium channel is dilate the blood vessels and nutrients are there and increases in the flow more oxygen and the blood and the nutrient to the hair bulb, so it's giving you hair growth. But these are the mechanisms we are using, 85% population are using. Limitation. What is the one limitation for the minoxidil? It's the solubility. It's a very big, because it's an alcohol soluble, so it's giving you itchiness, dryness and the scalp. What happened in itchiness and the dryness? Again dandruff will happen and again hair loss is started down. So, do you want a free from dandruff? Want itchy scalp? My answer is yes. What about you? I'm not getting, please? Yes. Okay. So we have a solution for the hair loss, not only for man, we have a woman for the aqua product, which is water soluble. We are only the manufacturer for that. We file the patent for the aqua grade product as well for that. Now I just would like to know that, like, what is the aqua grade is working, how it's working, how we are talking about that is better than other product, and what is the mechanism of action and how we can use for a different formulation. Copexil Aqua, it's it's regrowth lost hair. It's a one better application for that. I will describe in the next slide how its regrowth it happen, how it's a mechanism of action. Boost hair thickness because it's having an antioxidant property. Optimize hair growth cycle. It's increasing the starting phase, anagen, and the decreasing the resting phase. Fight against hair loss because of inhibitor of the 5-alpha reductase activity. So what is the conclusion? Conclusion is a visible hair rebirth. And the low, and what is the safety? Because no dry scalp, no itchiness, and that's safer. I'm just talking about all the Copexil Aqua, how it's working. I'm just going to prove that how it's work. These are the in vitro studies where we did the DHT inhibition assay for the DU145 cell line, which is the mainly responsible for the testosterone level. Here, you can see exactly how DHT works. DHT is a one dihydrotestosterone, which is responsible for the hair loss. How it happened? It converted testosterone to DHT in the presence of the 5-alpha reductase activity. If it is converted DHT, what will happen? DHT is a shorten the hair growth cycle because is a shortening this hair bulb and the follicle in the miniaturization of the hair follicle. When is the shortening of the length, hair are not growing. So if hair not growing, then hair start is a baldness is starting. The producing progressively shorter, finer, thinner hair, that is a cause for mainly hair loss. Now, I'll just give you the conclusion. We checked the study for the prostate cancer cell line. We compared with the available drug in the market, finasteride, flutamide, and the minoxidil 5% activity. Then we find out this Copexil Aqua is equivalent to that available drug in the market, without limitation, without side effect, and is a better efficacy. How Copexil is activate the channel and how it's inhibiting the DHT and how it's working for the anti-hair loss as well as hair regrowth. Here, this is a normal hair cycle. When it's converting a DHT testosterone level, then hair loss is started. Copexil, what will it? He that Copaxil Aqua is inhibiting 5-alpha reductase activity, so testosterone level is not converting DHT, which is responsible for the hair loss because the shrinkage of the hair follicles. When it's inhibiting is the hair 5-alpha reductase activity, hair loss is not happening. And the second thing, if DHT is not there, then hair growth starts right now. Here we can see how DHT is decreasing the hair fall cycle and how Copaxil Aqua is stopping that hair falling down and it increasing the hair growth. We did the in vitro study, we explained about it. Now, what is the question about the human beings? We check all the study in the human base as well, basically male alopecia patient. These are the topical application we applied for the 1 ml for the twice in a day for the 5-month treatment. We did the biochemical parameter, hematological parameter, not only biochemical, we check all the parameter is the molecular level. So that is very important for the genetic alopecia patient. These are the normal demographic data for that studies. What is the baseline? This is for the safety point of view. We check in the starting of the period and the end of the test protocol. We find out both parameters are similar and the same. So it's not going to change any demographic parameters. These are the hematological where we check all the studies for the RBC, platelet, neutrophils, lymphocyte, monocyte. These are the basic parameters which we have to know that is there any side effect, is there any change for those ingredients if we are using. These are the biochemical parameters as I mentioned. All these things we check in the starting as the end of the result. We find out both are the similar. Here, mRNA level we check. As I talk about that, we are not checking only the biochemical parameter, we check mRNA level, that is a molecular level, because alopecia is basically dependent on the genetic level, where we have to cure that, where we have to know that can we cure, can we control for those things. So remember, here is 6.3% available drug in the market improvement. In the next slide, I just compare with the same thing. These are the clinical results and the data where Copaxil Aqua is showing an improvement for the hair density as well as a hair regrowth particular area of that, and the anagen and telogen ratio is a dose dependent, and the we can see 2 month, 4 month and the 5-month treatment are the 75% or the 100%, and approximately anagen and telogen ratio we find out 50% of improvement within a 5 month of time period. These are the diagrammatic where you can see 2 months, we can see the single hair for the scalp, but after the 5 months in the same place we have observed that is a 2 and 3 hair follicle will happen. In the 5 months of a treatment we find out 50 to 60% of improvement in our scalp. Now, I just discussed about it earlier, mRNA level. 6.3% is an available drug in the market. Those 85% people are using for the minoxidil. We find out the Copaxil Aqua is a lesser concentration, same time period is giving a double effect, 12.6% improvement in the mRNA level. It's really it's a good improvement. Safety evaluation, as I mentioned, we check all the biochemical, hematological parameter. We find out that all parameters are very safe for the human studies. Copaxil Aqua is effective because it's inhibiting 5-alpha reductase activity. We are talking about the excellent because as a comparable, it's giving a good efficacy. Is a safer because there is no side effect and without any toxicity, and it's a very hair growth stimulant. That's what we are just talking about. Aqua grade we can use in a different type of formulation. Is a specification for that what is Copaxil Aqua. We are now thinking about what is Copaxil Aqua. This is the mainly one benefit for that Aqua grade, which is having an active ingredient with multifunctional compound. Multifunction compound is a oxo-thiodinocarboxylic acid, which is having antioxidant properties. What is the benefit for synergistic combination of the multifunction compound with the active ingredient. Minoxidil we can't use for the shampoo and that conditioner because it's a solubility problem. Now, it's an aqua grade, we can use in a shampoo, we can use in a serum, conditioner, gels and other things. This is a one prototype formula where we did the study for the human beings. We can use for the serum, lotion, shampoo, paste, but we did check the study for the eyeliner and mascara. It is safe and it's having a very good efficacy. We have, now I just want to emphasize one thing, not only one grade we have, Copex Aqua, we have a 3 grade of product, that is a Minoxidil Aqua as well as Copperol Aqua for that hair growth stimulant. Thank you.